Separation anxiety can feel overwhelming, whether it's a child who's upset when you leave or an adult who dreads being apart from a partner. It's not just normal worry. This kind of anxiety can weigh heavily on your mental health and your relationships. But here's the good news: it's something we can manage with the right tools. In this article, we'll break down what separation anxiety really is, its symptoms, and share practical steps to help both you and your loved ones cope. As psychologist Dr. Susan Albers notes, anxiety is not a sign of weakness. It's a sign that our body is reacting to stress and fear. Understanding it is the first step to overcoming it. What is separation anxiety? Separation anxiety is a natural emotional response that occurs when someone is separated from a person, place, or thing they feel deeply attached to. It's a common experience that we all go through at some point in life. Whether it's a child clinging to their parent at daycare or an adult feeling intense worry when their partner's away, it's all rooted in the fear of being disconnected from what feels safe and familiar. In children, separation anxiety often manifests as distress when a parent leaves the room or the home. It's an understandable reaction for young kids who are still developing their sense of independence. However, for adults, separation anxiety can lead to constant worry, panic attacks, or even avoidance of situations that require separation. While this type of anxiety can feel unsettling, it's important to understand that it's not always a sign of something serious. Sometimes it's simply a natural part of the attachment process. How to ease normal separation anxiety? If you're experiencing what seems like normal separation anxiety, there are simple strategies you can implement to reduce your stress and feel more secure. The key is to gradually build comfort with separation while offering emotional reassurance to yourself or others. One technique is to establish a consistent routine. This helps create a sense of predictability and security. For example, when leaving your child at daycare, saying a comforting goodbye in a calm, consistent manner can ease the anxiety. For adults, the same principle applies. Creating rituals or comfort routines before being apart, like a daily check-in or leaving behind a token of reassurance, can help manage feelings of anxiety. Another way to ease anxiety is by gradually increasing the time spent apart. By starting with short periods of separation, you allow yourself or others to build confidence over time. As psychological studies suggest, exposure therapy, gradually confronting fears in a controlled way, is often a key technique for overcoming anxiety. What is separation anxiety disorder? While separation anxiety is a normal response in many situations, for some, it becomes more severe and persistent, evolving into what is known as separation anxiety disorder, SAD. This condition goes beyond the typical worry about being apart. It can interfere with daily activities, relationships, and overall well-being. People with SAD experience intense fear or panic when separated from a loved one or when they anticipate separation. This could be from a partner, child, or even a close friend. The anxiety doesn't just pass with time, it can escalate, leading to avoidance behaviors, where the person may go to great lengths to prevent being away from their attachment figure. For children, this might manifest in refusal to go to school or other places away from their primary caregiver. Adults with SAD might avoid work travel or even social gatherings. Recognizing the difference between normal anxiety and SAD is crucial. While everyone feels anxious at times, persistent fear that hinders daily life is a red flag. According to Dr. Judith Rappaport, an expert in child psychiatry, separation anxiety disorder doesn't just affect kids. It can cause significant distress in adults as well, often leading to other mental health issues like depression or generalized anxiety. Separation anxiety disorder goes beyond the typical worry many experience when faced with separation. It's a condition marked by intense, disruptive fear that doesn't ease with time. If you or someone you love experiences persistent anxiety that impacts daily life, it might be time to consider the symptoms of SAD. These symptoms can show up in a variety of ways, both emotional and physical. Common signs of SAD include excessive worry about losing a loved one or about an event that could cause separation. This worry often leads to physical symptoms like headaches, stomach aches, or trouble sleeping. In children, This may present as extreme distress when it's time for school or daycare, crying, clinging, or refusing to leave a caregiver's side. For adults, the symptoms might manifest as avoidance behaviors, avoiding work trips, social events, or even conversations about being apart from their partner or family. Additionally, people with SAD often experience an overwhelming desire to stay in contact with their loved ones, sometimes resorting to constant texting or calling when apart. In more severe cases, the anxiety may escalate to panic attacks, leading to feelings of dizziness, heart palpitations, and even fainting. If these symptoms last for more than a few weeks and disrupt everyday functioning, it's time to reach out for professional support. Understanding the root causes of separation anxiety disorder is essential to addressing and managing it. While the triggers can vary from person to person, there are some common underlying factors that contribute to its development. One of the most significant contributors is early attachment issues. Children who do not form secure attachments with their caregivers may be more prone to developing separation anxiety as they grow older. Traumatic events can also be a major cause. If someone has experienced a significant loss, such as the death of a loved one or a sudden traumatic change like a parent's divorce, it can trigger separation anxiety symptoms. This is the mind's way of attempting to avoid further pain by clinging to what feels safe. In some cases, genetic and biological factors also play a role. Studies have shown that anxiety disorders, including SAD, can run in families. A child with a parent who has a history of anxiety or depression may be more likely to develop similar symptoms. Additionally, children with overprotective parents who limit their independence may struggle with separation as they grow older. On a deeper level, separation anxiety can also be linked to a person's overall stress levels or other mental health conditions. For example, people who experience chronic stress or who have existing anxiety disorders are more susceptible to developing SAD. The combination of genetic predispositions and environmental factors creates a perfect storm for anxiety to take hold. Separation anxiety or trauma. It's easy to confuse separation anxiety with trauma. Both can cause intense emotional distress, but they stem from different origins. Separation anxiety is a natural response to being apart from loved ones, while trauma results from a past event that has caused lasting emotional or psychological harm. Understanding the difference is crucial in determining the right approach to treatment. While both conditions share similar symptoms, fear, anxiety, and avoidance, the underlying cause is what sets them apart. Separation anxiety typically arises from the fear of loss or separation itself. Trauma, on the other hand, may be rooted in a past event, such as the death of a loved one, a car accident, or any situation that caused significant emotional damage. It's possible for someone with separation anxiety to also have experienced trauma, which can complicate their symptoms and treatment. That's why it's essential to work with a mental health professional to properly diagnose and treat the condition. When it comes to children, dealing with separation anxiety disorder, SAD, can be incredibly challenging for both the child and the parent. Children with SAD often experience a heightened sense of fear and distress when faced with separation, which can lead to tantrums, clinginess, and refusal to leave the caregiver's side. The good news is that with patience, understanding, and a consistent approach, children can learn to manage their anxiety. One of the first steps in helping a child with separation anxiety is validating their feelings. Instead of dismissing their fears, acknowledge them. Let them know that it's normal to feel anxious sometimes, but that they are safe and will be okay. Dr. Daniel Siegel, a well-known psychiatrist, explains, when we tune into a child's emotional experience, we build a sense of security that allows them to explore the world with greater confidence. It's also important to gradually increase the child's exposure to separation. Start with short, manageable separations and gradually extend the time apart. This builds resilience and allows the child to realize that separations don't always result in fear or danger. Be consistent with routines. Predictability can be a powerful tool in reducing anxiety. For example, always say goodbye in the same calm, reassuring way and stick to regular pickup times. This consistency will help the child feel secure and less fearful of separation. There are several strategies you can use to help your child feel more secure and comfortable when facing separation anxiety. The goal is to reduce the distressing emotions associated with separation and, ultimately, to build your child's confidence. Here are a few practical tips. Use comfort objects. A favorite blanket, stuffed animal, or photo can offer emotional support during times of separation. Stay calm and reassuring. Children are highly attuned to their parents' emotional states. If you remain calm and confident, they're more likely to feel secure. Establish a goodbye routine. A consistent and predictable goodbye ritual can provide comfort. It could be a special handshake, a hug, or a secret phrase that signals it's time to say goodbye. Practice separation in small doses. Gradually increasing the time away can help the child learn that separations are not permanent, and they will always be reunited with their caregivers. School is often a source of separation anxiety for children, especially those who struggle with SAD. The thought of being apart from their caregiver for an entire school day can trigger intense feelings of distress. But there are several strategies that can make the transition smoother and help ease your child's anxiety. First, prepare your child by talking about the school day in advance. Help them visualize the day ahead and reassure them that you will be back to pick them up at the end. Establish a positive, calm morning routine. Rushing or showing signs of anxiety can transfer to your child, so aim for a relaxed, organized start to the day. Another helpful strategy is to develop a safe space at school. This could be a specific teacher, a classroom corner, or even a school counselor who can provide comfort if the child starts to feel overwhelmed. You may also want to work with the school to ensure that your child feels supported and safe. If needed, a teacher can offer quick reassurance throughout the day or help them stay engaged in activities that divert their focus from the separation. It's no secret that children pick up on the emotions of those around them, especially their parents. If you're feeling anxious, stressed, or overwhelmed, your child is likely to feel the same way. Managing your own stress can play a pivotal role in helping your child cope with their separation anxiety. When you're calm and centered, you're better able to offer reassurance, stability, and the emotional support your child needs. Start by taking care of your own mental health. It might feel counterintuitive, but focusing on your own well-being isn't selfish, it's necessary. Make time for self-care, whether that means going for a walk, practicing meditation, or simply talking to a friend about your feelings. Studies in psychology show that parents who model healthy coping strategies help their children develop similar skills for managing anxiety. Remember that managing stress isn't a one-time fix. It's an ongoing process. Regular practices like deep breathing exercises or mindfulness can help you stay grounded, especially in moments of stress. By managing your own anxiety, you not only improve your mental health, but also help create a calmer, more secure environment for your child to thrive in. At times, despite our best efforts, managing separation anxiety, whether in children or adults, can become overwhelming. If you've tried various coping strategies and your child's anxiety is still disrupting their daily life, it may be time to seek professional help. This is especially true if the anxiety escalates to the point of panic attacks, avoidance behaviors, or if it starts affecting their social development or academic performance. For adults, seeking professional help is important if the anxiety begins to interfere with relationships, work, or other important areas of life. Therapy, especially cognitive behavioral therapy, CBT, is one of the most effective treatments for anxiety disorders. CBT helps individuals identify negative thought patterns and learn healthier ways to respond to anxiety-provoking situations. If you're unsure about whether to seek professional help, consider these signs. Your child's anxiety is causing frequent disruptions in daily activities like school, play, or family life. The symptoms have lasted for more than a few weeks without improvement. There are significant behavioral changes, such as aggression, withdrawal, or difficulty connecting with others. Don't hesitate to consult a therapist, counselor, or pediatrician to assess your child's needs and find a suitable treatment plan. Effective treatment for separation anxiety typically involves a combination of behavioral interventions, therapeutic techniques, and, in some cases, medication. For children, one of the most common treatments is cognitive behavioral therapy, CBT, which helps them identify and challenge their anxious thoughts and fears. CBT also teaches them coping skills that can reduce their distress during separations. In some cases, especially for children or adults with severe separation anxiety, therapy may be combined with medication. Selective serotonin reuptake inhibitors, SSRIs, a type of antidepressant, are often prescribed to help reduce anxiety symptoms. Medication is typically used when anxiety is so severe that it significantly interferes with daily life or other treatments haven't been effective. Another key aspect of treatment is parent training and family involvement. Parents can play a critical role in reinforcing therapeutic strategies at home. This might include practicing gradual separations, maintaining consistent routines, and providing emotional support during times of stress. The more engaged you are in the treatment process, the better the outcomes for your child. For adults, a combination of CBT, mindfulness practices, and stress reduction techniques has shown significant success in reducing anxiety. In more severe cases, medication may also be prescribed, particularly when the anxiety has led to other issues such as depression or general anxiety disorder, GD.